my name is Jill Reiter, and I want to share with you 5 tips for pregnant women who are in the know. Tip number 1, choosing a provider. You want to choose a provider, either a midwife or a home birth midwife or an OBGYN who's well versed in the kind of birth that you want to have. Don't just pick someone out of the phone book. Try to find that happy medium between what is covered by insurance and someone who's well versed in the kind of birth that you want to have. Okay, tip number 2. This has to do with classes, and there are 2 classes for tip number 2 that I recommend that you take. The first one is a childbirth education class. There are many different methods that you can choose from. The second class is a breastfeeding class, and if you can take a breastfeeding class, you're going to feel so much more prepared for breastfeeding your baby. Tip number 3 is to interview and hire a doula. There are actually 2 kinds of doulas, labor doulas and postpartum doulas, and I'll talk a little bit more about both in just a minute. But for now, let's talk about the research about labor doulas. In a meta-analysis of 11 clinical trials, it was shown that having a labor doula present continuously throughout labor significantly shortened labor. That's a good thing. And decreased the need for analgesia, Pitocin, cesarean sections, and forceps. Learn more at kappa.net. The main difference that a lot of people don't always understand is that doulas are non-medical. They're not there to catch the baby. They're there for you, mom. They're there for the pregnant woman, the expecting mother. They're there to support you. They also support partners in labor, and oftentimes partners are the ones who are the biggest cheerleaders for doulas after the birth. Don't forget about postpartum doulas like me. Postpartum doulas support families after you have a baby. That's why I call myself the after baby lady. Interview doulas while you're pregnant. This is huge. That way you'll get the people that you want to work with. Tip number 4 is understand informed consent. Informed consent is consent by a patient to a surgical or medical procedure or participation in a clinical study after achieving an understanding of the relevant medical facts and risks involved. What this means to you is you want to make sure and ask all the questions that you have regarding any medical procedure. Optimally, you do this before you have your baby. Just like you would for a cell phone or a car, don't ever feel bad about asking questions. Tip number 5. I want you to do this tip with me right now. Take a deep breath. Put your hand on your belly, and I want you to send your baby some love. Think about how excited you are to meet the little one that's growing inside of you right now. Keep breathing and know that your baby can actually feel the love that you send them. Now imagine getting to see your baby and kiss your baby. It gives me goosebumps. Feel all those happy thoughts. That's tip number 5. Hi, thank you so much for watching. I would love it if you would hit the like button and comment, tell me what you think about the video. Also, if you share it, just know that every time I get to share, I'm doing a happy dance at home.